My name is Vladimir Sepkolenko, and I am the head of the Institute of the Plastic Surgery Virtus and founder of the biotechnology company SmartCell. I am also professor of dermatology, venerology, and allergy department of the Shupik National Medical Academy of Postgraduate Education, and the president of the Ukrainian Association of Aesthetic Medicine. How did you open the first aesthetic medicine clinic? When I was getting an internship in France, I received an official invitation to work in the Red Cross. I received support to join the French Red Cross team. However, I didn't move to France as my foreign colleagues convinced me to stay in my native country. In their opinion, Ukraine had great potential in the healthcare industry, so they gave me a chance to work on it. In addition, the Red Cross offered a lot of internship opportunities abroad, where I have gotten an enormous amount of different experiences and knowledge of modern technologies. My colleagues helped me to find good job positions in private hospitals in France back at that time. I saw impressive work of small hospitals doing complex things. Interestingly, not only wealthy patients could affect such kinds of treatments. I was impressed by the teamwork and democratic atmosphere in the private clinics. Exactly this observation made me think about establishing a private clinic in Ukraine. But at that period, we had hard times renting and paying for our own place. So we opened a small cosmetic surgery clinic on the sanatorium territory with an ultrasound, laboratory, screening, and reanimation room. With time, we realized we didn't have any real competitors in Ukraine. So I would say we were the pioneers back then. We were the first to install a laser in 1994. And then, after years of practicing, we published the first plastic surgery book and another one about dermatology and aesthetic laser healthcare. This book is still being used as a tutorial in Ukrainian and Russian universities. How did you change direction to open the biotechnical company? We did a lot of histological tests and examined the aging of the skin back in 2002 while I was getting my doctorate in dermatology. I asked my supervisor, who was also a chief of the Institute of Dermatology, to check my doctorate, and the next day I got a call from him. This is how I finished my anesthesiologist career and became a professor of dermatology. We created a classification. We had all the statistics on aesthetics. In 2012, amidst lasers, injections, Botox, and so on, we came to the conclusion that it was a huge deception. I'm not talking about lasers, but about these fillers, hyaluronic acid, and Botox. People started going through the rejuvenating surgeries much earlier than they had to. This is on the one hand. But on the other, if in 2002 skin cancer was in 7th place, then in 2012 it came in first. After noticing this trend, I firmly decided to establish a new direction. We could not and didn't have the right to harm our patients. That's how we opened our biotechnical company and started using autologous drugs only. Today, it's rooted as our philosophy and the subject of our science. The potential of regenerative technology in medicine. Academician Filatov received a state prize for a monograph on the placenta back in 1956. And in 60 years, technology has reached a new level. Filatov back at that time was working on sprouted grains and phytostimulation. Of course, today, these are well-known growth factors in medicine. But at the beginning of the 2000s, the Spanish doctor received the Nobel Prize for the selection of growth factors. And in 2019, regenerative medicine came out on top in the world in terms of investment. Last year, $17 billion was invested into the research and development of regenerative medicine in traumatology and orthopedics. When I am at the international conferences abroad doing a regenerative medicine speech on behalf of a private clinic, my fellow colleagues usually ask who my sponsors are. Of course, we try to invest all the efforts on our own to develop the specialization. Not more and not less we can do. Our next step is to grow our own tissues for use in plastic surgery. How is the laboratory used today? Today, our lab is doing substitution therapy and bioinsurance. We all know that if the person does not produce insulin, he can die. But if we inject insulin into his body, he will live long in case he follows the regime, meaning his life will not differ from other healthy people. The same works for thyroid hormones. Today, we don't face any serious diseases as people did 30 to 40 years ago. There are no longer those severe cases of Graves' disease or diabetes mellitus, when a person dies due to the hormone metabolism disorder. Today, we have hormone therapy and timely diagnosis of the pathologies. The same is in climax, women's health, and acne, where the changes in the hormones are the basics of the disease. There is a bone marrow that produces stem cells, so-called the reserve of life. Bone marrow is also responsible for how our bodies combat the diseases and the time of recovery after stress or injuries. Our genes determine the quantity of produced stem cells, and when aging, the number of cells are decreasing. People who never had any serious illnesses die anyway. That's how we are built. We don't die because life ends, we die because our body stops producing stem cells. Every day, millions of our cells are dying due to the stress, pressure, or environment. But every night, millions of new cells replace them. They get into the bone marrow, heart tissue, nerve tissues, etc. When we are young, we can stand many sleepless nights feeling energetic. But when aging, people can wake up after a good sleep and are already tired. This is a sign of the scarcity of stem cells. Women don't visit doctors because of wrinkles only. They visit them because of tiredness, memory loss, blood pressure, loss of libido, and gait disturbance caused by the joint disorders. These are the real aging indicators, and we do the anti-aging for them. We are developing the substitution cell therapy, which can be local in the case of skin care or joint replacement if it is causing arthritis and pain. Also bones, liver, hearts, and other organs. The substitution cell therapy can be used locally and systemically. The systemic application we use in case the person has aging issues, stresses, or injuries. Sometimes the injury or disease is not serious, but they can cause the long aftermath and recovery. Why? Because traumas and illnesses affect bone marrow and the body has hard times to combat the disease, especially infections, pneumonia, bed sores, or cystitis. It all happens due to the scarcity of stem cells that were burned while healing injury. We are growing stem cells for patients with severe injuries during a month. But during the month, while cells are growing, we use the cells extracts to speed the recovery of the patient. Till the healing process starts, stem cells are already grown and ready to inject. This process prevents patients from having complications after injury. We use stem cells to treat autoimmune diseases of the thyroid, central nervous system, liver, or skin, as the main target of stem cell therapy is to boost immunity. We cooperate with the National Institute of Surgery and Transplantology, named after Shalimov, to introduce stem cells during the coronary artery bypass grafting, during the open heart surgery, when the patient needs restoration of blood circulation. These cells are introduced into the heart muscle to form cardiomyocytes. The heart has to function regularly, allowing the patient to live a full life. This is not stimulation, but a substitution therapy. Thus, when a patient feels the aging signs, it's recommended to go through stem cell therapy with a small amount of his own cells, which will prolong and support the quality of his life. For our audience, we create an easy name for these complicated terms and call it cellness. Cellness goes after fitness and wellness, when they are not enough to keep the patient on track. We always speak with patients about biological insurance, where they can give the piece of their skin to a cryobank before it gets old, sperm, blood cord, or bone marrow for stem cells. The aspects of stem cell therapy vary. We have the possibility, unlike our parents, so we have to use it. Now, people of any age can donate healthy blood cells. We control the process and store active and young cells that are so needed for any of us. We also have learned how to specialize stem cells in the cartilage tissue, bone tissue, homeopathic liver cells, and neurogenic direction. We also restore the liver after the infection diseases, different types of cirrhosis. We treat patients with traumatic brain injury, toxic damage of the central nervous system, and stroke compilation. We help those patients to come back to full life. This subject has a huge potential, and I didn't even name a half of the other diseases we can cure. We have learned how to combat oncology using stem cells, and now working on the cancer vaccine and growing lymphocytes to kill specific tumors. Same to fight COVID-19 with stem cells, as each of us already heard about this new method. The cryobank can prevent or cure numerous unexpected health problems people can face. Thousands of patients used our cellular therapy, and what is amazing is we didn't have a single compilation but had great results. We are absolutely confident in how our clinic is developing in terms of regenerative medicine in a variety of directions, and upon the requests of our patients. Our ophthalmologists restore the vision, otolaryngologists restore smell, voice, and hearing functions. Traumatologists restore joints, plastic surgeons rejuvenate skin in a natural way using patients' own cells, unlike what we can get from the big markets. This is our position, which is in high demand today among young people, especially programmers who are burnt out, businessmen who lead an active lifestyle, sportsmen to treat their joints, and anyone who asks for help. Why is your lab so unique? We have a specific position, which is modern regenerative medicine. We have created the terms and algorithms which work in a harmonious way. And prior to introducing stem cells, we check properly if we have cleaned them correctly, using the proven effective tests for stem cell therapy.